Hello, welcome to the special podcast of Ahmedabad Management Association. And the aim of this podcast is prevention of heart attack, which is now becoming a very major problem for our society. Today with us we have eminent cardiologist Dr. Shah, who is attached to HCG Hospital and many more hospitals of Ahmedabad. And we are going to discuss something basic related to heart attack. So, Dr. Jai, my
Yes,
first
sir.
question will be, what changes you are looking at in the recent years compared to the past? What are the changes you see in the practice?
So, sir, thank you so much for the invitation. What I have seen and what all the cardiologists they are seeing is that the trend is going towards more of a young heart disease. Unfortunately, India is the country where you see a lot of premature or a young heart disease. By definition or by all our textbooks, what we see is that we get the data of having heart disease at the age of 55 or 60 or 65. But unfortunately, in India, especially in those so-called urbanization or urban cities, we see a lot of cases which are falling into the category of third decade and fourth decade. That means 30 to 40 years and 40 to 50 years. Lot many cases are now becoming rampant, and understandably, I think we can say that this young heart disease is nothing but related to sedentary lifestyle, unhealthy food habits, more of a altered sleep pattern, lot of mental stress, target oriented job or job stress. Then I would say that there is definite amount of a role of environmental factors like air pollution. And after COVID-19, what we have seen is that a lot of young hearts are getting affected by COVID-like viral illnesses. And these are the things which completely has changed the trend towards the development of heart disease. Having said that, I think genetic influence is something which cannot be left alone. So that is something which is going to be having, because it is a non-modifiable or a unmodifiable risk factor. So whenever you have a family history of premature heart disease, young patients are getting affected because of that as well.
Okay, you mentioned about the young patients getting the heart attack. Now, we know that there are two type of risk factor. The one is non-modifiable and the second is modifiable. And you gave a like lot of risk factors which is responsible for the young or the heart attack at the young age. Now, if someone has a family history, then what precautions they need to take?
So someone who is having a family history of heart disease could be in two major forms. One, it is in form of ischemic heart disease. That means the blood supply related heart attack or a heart disease. Second, which runs in family, is known as cardiomyopathy. And that is something which is always being left alone or rather unexplored, because this is something which requires a lot of attention. The condition is known as hypertrophic obstructive cardiomyopathy. If it runs in family, then even at the young age you can have a history or a incidences of sudden cardiac death, and that is something which has been assumed as a heart attack, but actually it is a arrhythmic attack or a arrhythmic episode which has led to sudden cardiac death. So family history is extremely important. It is non-modifiable. There is a genetic preponderance. So all those who are having family history of heart disease, especially at a younger age, they must be checked very regularly for their routine cardiac status. And some of the things you can pick up on the basis of newer technology as well. Like you have now smart watches, you have echocardiography. There are certain AI based risk scores by which you can definitely diagnose that this patient is having a likelihood of development of heart disease in near future. So that sort of period gapping you can always measure.
Okay, what is the youngest age where you have seen a patient with heart attack?
Unfortunately, at the age of 14,
14.
14, that was the youngest patient where I had to operate. When I was studying at UN Mehta Institute of Cardiology, there was another child, 14-year-old, that was being treated due to significant blockage in the left coronary artery and the right coronary artery. Similar sort of patient, but having a thrombotic involvement. That means he was having nephrotic syndrome and he had a clot inside his right coronary artery, which was prematurely developed at the age of 14. And we had to suck that thrombus, and without putting a stent, we treat that condition. But after that, there are like just 3 months back, I had unfortunately operated 2 cases. One was 18 year of age. On the same day, after 2 hours, second was 23 year of age.
Oh, that's
So these
really
are the
shocking
alarming and shocking incidences which is happening very regularly nowadays.
Okay, so coming to another important aspect, and that's diet.
Yes.
Our diet is becoming like standard American diet, which is in short called SAD. So, what is the effect of that diet on heart attack?
A very, very important question, sir. It's a huge impact. Unfortunately, we are, as an Indian or especially as a Gujarati, we are taking a lot of carbohydrates. Our diet does not contain protein or a green leafy vegetables, but more of a carbs and fat.
Right.
And that is something which is actually responsible for producing a lot of inflammation and atherosclerosis inside the coronary arteries or the heart arteries. The diet which is being recommended for heart disease is known as DASH diet. That diet was basically planned for hypertension. The full form of DASH is dietary approaches to stop hypertension. But what does it contain? It contains more of a Mediterranean diet. It is containing a lot of green leafy vegetables, whole grain, nuts, then comes proteins, then comes the role of a little bit of fat and carbs. So this is how I think they have formulated the diet. The diet which is rich in fibers, the diet which is having a lot of potassium and magnesium, that is also going to be very healthy in controlling hypertension. And as we are aware that India is going to be the capital of diabetes in near future, all sugary beverages, salt and extra sugar which is being sprinkled on the already made food, all these things are actually going to be the risk factor for the development of heart disease. And for the young population, I wanted to give one simple importance of having a bakery items.
Right.
All cakes and pastries and cream based therapies and cream based food items. Not only that, now there are a lot of cafes. Cafes are opening like gallas.
Yeah.
They are like mushrooms. Now all these cafes are having a lot of cream in their formulation. Either they are adding some chocolate or cream or anything which is having a lot of sugar. So all these things are actually going to be the risk factor for the development of heart disease in a younger age. And as we are talking about diet, there is another thing which should not be left alone is the habit. Habit in form of tobacco, smoking, alcohol, and habit of having a sugary diet. People are having a habit of extra salt and sugar in their diet. So these are the things which requires a lot of attention.
Okay, so diet is one component which we need to take care. What about the exercise?
Yes, extremely important. So in nutshell, if I wanted to give you a very small single statement, exercise in form of walking 150 minutes a week. That should ideally be followed by each and everyone. So if I do it in a fragmented way, it is 40 minutes per day, 5 days a week. That is something which has already been recommended. It is more than enough. Do not assume that those who are doing jogging are more healthier than those who are doing walking. Even a dancing, swimming, jogging, all these things are, or cycling, all these things are the mode of exercise. And this exercise is anyway going to give you more healthier cardiac status. So exercise in form of all these things, either walking, jogging, swimming, dancing, anything, or cycling, anything is going to help you because it produces a lot of conditioning in the heart muscle, and that is going to give you more healthy status of the heart.
Okay, and what about the weightlifting? Because
Yes.
in young people, in youth, the strengthening is very important because
Very important.
It helps in building
Building the muscle.
mass.
Very true, very true. So all these patients or all the population who are doing regular exercise, they should do at least twice weekly muscle strengthening exercise. They are known as isotonic exercise or a resistant exercise, which ideally should be done to have their building of muscles. So muscle should not be vexed, or it should not be having any sort of deterioration. Just by reducing weight, it is not going to help. Reducing weight in form of fat is going to help, but reducing weight in form of muscle is going to make you more weak. And that is where I think the history of fall is going to be very, very important, and that is where I think the strengthening exercise is going to be extremely important.
Okay, coming to the third element of the problem, and that is stress. Everyone has stress, but the youth or like the young people, those who are in the second or the third decade of life, they have a lot of work pressure. So, is it responsible for heart attack?
Absolutely, sir. Stress, any sort of stress, whether it is mental, emotional, or target oriented stress, ultimately stress is what, sir? Stress is our own intelligence is going against us. That is called stress. So we must know how to respond to any sort of stress, and this stress is probably an inevitable thing in our daily life. So I've read one quote in one of the happiness or Zen book, which is showing that, or rather quoting that pain is inevitable. Similarly, this stress is inevitably, but suffering is optional. So that is something which we must remember. And stress is a part of our life, but how to balance our work life with the existing scenario is very, very important. So stress, how does it affect heart disease? That is also very important. Stress produces weakening of the layer which is covering the heart blockages. It produces more of an inflammation inside the plaque. Plaque is nothing but a layer of cholesterol or the deposition of the cells. They are known as fatty cells or foam cells, and the layer which is covering that cells is becoming weakened because of this stress. And that is where I think you get a rupture or the fracture of that plaque, and it will produce a sudden clot in the coronary artery, and it will invite the heart attack event. So that is something which can be curtailed with the help of yoga,
Stress
meditation,
management.
exercise, and good sleep and stress management. So what I wanted to give as a part of quote which has been, which was being, I have come across that from a Zen book, that pain is inevitable, but suffering is optional. So that is something which we must remember. So stress is never going to be away from our daily life, but how to combat that stress is extremely important.
What one tip you would give to the young people to manage the stress?
To manage the stress, sir, we must understand first and foremost that are we happy in doing what we are doing? If you are happy in what we are doing or what you are doing, stress will not come. Stress will only come the work which is being done by you, which is not giving you a good or happiness. So that is where I think the whole chain of events will start. So to combat that, I think you should have a good sleep. That is number one. Yoga, meditation, I agree that it is going to definitely help in reducing the stress. Similarly, even the simple form of exercise or walking, when you walk consistently in a disciplined way for a few days, say for example, if you are walking it for 21 days, I'm sure that the happy hormone is going to get released. Dopamine, endorphin, these are the hormones, they are going to get released, and that will help in relieving stress. Now, stress is something which is being connected with a lot of other risk factors of the heart disease, like diabetes, high blood pressure, obesity. All these things are getting reduced when you are relieving stress. So, I think it is very imperative to know that we all know that these are the things or these are the measures by which you can reduce stress, but whether we are doing it in a disciplined way for a consistent period of time, that is where I think the whole importance should be.
Okay, if someone comes to you and asks a simple question that how many hours of sleep is good for the heart, what will be your answer in digit?
In digits, 7 to 9 hours a day.
7 to 9
9
hours.
hours a day.
Right.
So this is something which has already been documented as a part of guideline in our textbook and the recent newsletter. But having said that, as an Indian, or what we are seeing, 6 to 8 hours of per day sleep, sound sleep, is more than enough to have a good rejuvenation on the next day, to get all these things, because while we are sleeping in a sound form, all these parameters like blood pressure, sugar, all the mechanism, all the circadian rhythm is going to get reset, and that is where I think on the next day you can feel energetic.
Okay, and how? What are your ideas or the views of tackling this problem of heart attack in young people? What are your ideas? Like what we can do? What you said is like the change of the lifestyle is one
Correct.
thing. What else? The early investigation.
Yes, so the detection is extremely important. Detection or early detection is possible only if you get yourself checked. So the healthy or a regular health checkup is extremely important.
Right.
And I would recommend that after the age of 20 now, we must get once a year a routine health checkup. I am not saying that people should go for every time the exercise test or a ECG or echo, but at least once a year blood investigation should ideally be done.
Right.
Gone are those days where we are seeing that the patient will have some problem after the age of 40 or 45. We are seeing a lot of young individuals who are having heart disease, and they are not having any major risk factor, but they are developing it. So there are certain risk factor, they are known as novel risk factor, which is there as a part of young coronary artery heart disease. If you have checked it once in lifetime, you are aware about your own risk for the future development of heart disease. So that is something which requires a lot of attention, that a regular health checkup should be done. Those who are having premature coronary artery heart disease in the family history,
Yeah.
they should also check themselves every 1 year or every 6 months if they are already having 1 or 2 risk factor. Like those who are having hypertension, diabetes and having a family history strong, then I would suggest that every 6 months they should get themselves checked. There are many ways by which cardiac part is being checked in form of ECG, echocardiography, treadmill test, and nowadays we are doing a lot of coronary artery calcium score. Now that score is also going to give you the idea about the presence of or the development of atherosclerotic heart disease in the artery. Now that score does not mean that you are having a blockages. It is just going to show you the importance of disease development in the heart arteries, so that you can get yourself checked on a regular basis. If at all you require some sort of medicine, you can start it early and you can delay the progression of the disease, and you can prevent yourself from complication of those diseases.
Now the next question, I think that it's not relevant for Gujarat, but still I am asking you that what is the role of alcohol and the drugs? Both are illegal in Gujarat, but still, as per my awareness, it's common in our country and more so in youth.
Very true.
So, what is the effect of alcohol and drugs on the heart?
So, as you are aware that Sir, Gujarat is anyway out of this, but at the same time, for the sake of discussion, we must know that how much of alcohol is being recommended by the guidelines, the heart guidelines. The heart guideline, they say that red wine or 30 to 60 ml of hard liquor is being allowed, but in a moderate
30 to 60 ml
per day is allowed. That is a Western population guideline. There are ample of data available and the guidelines are available for Asian population in India. Even a smallest amount of alcohol is injurious to your health. So in India, this statement does not hold true. So the amount of alcohol in a shorter duration of time. So if you are taking a lot of alcohol, which is known as binge drinking, in a shorter period of time will invite a lot of alcohol related toxic effect on the heart muscle. It will lead to a lot of irregular heartbeats or skip beats or drop beats. And that is the reason there is a scientist or a very, very well-known familiar figure in the cardiology field, that is known as Dr. Inas, who has done maximum work on the Asian Indian population, where he has suggested even a smallest amount of alcohol is going to be injurious to health and going to be injurious to the heart health. That is what we have been taught, we have been studied.
And what will be the message you would like to give to the youth related to this heart safety and the heart attack prevention?
So, heart attack prevention requires a lot of discipline. First and foremost, we must understand that we should undergo a lot of battery of investigations at an early age. So, early detection is very important, and that is possible by doing a regular health checkup. Simple tests like lipid profile, HSCRP, lipoprotein little a, ApoB, ApoA1, HbA1c, fasting blood sugar. These are the tests which we must do.
So these are the tests which are usually covered in the good standard body profile.
Yes, correct. So these are the tests which are already been covered. Apart from that, on a physical note, waist-hip ratio is something which is important to note. Both are different in male and female. And as an individual or as a young population, we must know the numbers. Which number is going to be suited for us? That means, what should be our heart rate? 60 to 80, ideally 70 beats per minute. What should be our ideal blood pressure? Less than 130 by 80 millimeter of mercury, ideally it should be there. What should be our bad part of the cholesterol? LDL, ideally it should be 100 or less than 100. What should be my HDL, which is a good part of the cholesterol? Ideally it should be more than 40. What should be my triglyceride, which is again a bad part of the cholesterol? It should be less than 150. And what should be my regular or a routine HbA1c? Ideally, it should be less than 6.5. Preferably, it should be less than 5.7. So these are the numbers. If you remember this and then get yourself checked on a regular basis, I think we can prevent lot many things. And that is the reason nowadays the future is going to be getting all these things done. AI-based risk scoring system. There are digital health parameters which are available. People are doing a lot of remote monitoring. People are having a AI-based scenario where just by taking an ECG, say for example, I am taking an ECG of one guy, the AI will give me the idea about the future damage or a development of heart disease in that patient just by looking at the ECG. Similarly, there are certain AI-based programs available for echocardiography. Just by looking at the echocardiography, you can predict the future implication of this parameter, whether it is going to deteriorate in next 4 or 5 years or not. So these are all new development or futuristic development in the field of cardiology. And as an interventional cardiologist, we do a lot of imaging and imaging related angioplasties where we are using AI in left, right and center. Everything is based on that, and it is going to give you extremely important, accurate result, long-term result for all those patients. But here, at this point in time, I think it's always better to have a more prevention related things as compared to treatment.
Yes, so this is going to be a very important that what we discussed today was in brief, but the same thing we are going to discuss in 4-hour period. So we are going to discuss minute details related to each risk factor, and we request you to join this program on the 6th July at Ahmedabad Management Association. Thank you.
Thank you. Thank you so much.